Gastrointestinal perforation. Definition. A perforated bowel is a hole that can develop anywhere in gastrointestinal (GI) tract, which runs from throat to rectum. If GI tract is perforated, the contents may spill into abdomen and cause peritonitis or GI infection. Intestinal perforation is a hole in the wall of the intestine. A perforation may be a puncture, cut, or tear. The opening allows air and intestinal material to leak into the abdominal cavity. The material can lead to a serious infection. Causes. Bowel perforations may occur spontaneously, unexpectedly, as a result of a medical condition, or instead be a complication of various diagnostic and surgical procedures that accidentally creates a hole in the colon. Trauma, especially blunt trauma to the abdomen, is also an important cause of bowel perforations. Procedure-associated causes include enema. An improperly or forcefully inserted rectal tube for an enema can rip or push through the colon lining. Bowel preparation for colonoscopy. Rarely, the bowel preparation for a colonoscopy can result in a perforation. This is more common in people with a history of constipation. Sigmoidoscopy. Although the endoscope for a flexible sigmoidoscopy is flexible, perforation remains a risk, but a rare one. Colonoscopy. The tip of the endoscope has the potential to push through the inner lining of the colon, although this is a rare complication of the procedure and is not seen in the virtual colonoscopy. Abdominal or pelvic surgery, particularly colon surgery as for colon cancer, may be a risk for perforation. Spontaneous causes. Causes of spontaneous bowel perforation, those unrelated to surgery or procedures, include inflammatory bowel disease, colitis such as Crohn's disease and ulcerative colitis. The lifetime risk of bowel perforation with Crohn's disease is between 1% and 3%, making this a very common cause. Severe bowel obstruction, especially when the colon is weakened by diverticular disease, another process, or cancer. Trauma. Ischemic bowel disease, when the blood supply to the colon is compromised. Colon cancer. Foreign body ingestion, most commonly due to the ingestion of fish bones and bone fragments, as well as non-food items. Severe bowel impaction. Risk factors. Risk factors may include recent or prior abdominal surgery, recent or prior pelvic surgery, age greater than 75, history of multiple medical problems, trauma to the abdomen or pelvis, such as in an automobile accident, a history of diverticular disease, a history of inflammatory bowel disease, colon cancer, use of the monoclonal antibody immunotherapy drug ipilimumab, pelvic adhesions, scar tissue, usually related to previous surgeries. Female sex. Women typically have a more flexible colon, which can lead to accidental perforation during medical procedures, including a colonoscopy. Diagnostic and surgical procedures involving the digestive tract, abdomen, or pelvis. Sign and symptoms. The symptoms of a bowel perforation can vary and may come on slowly or rapidly depending on the underlying cause. Symptoms may include abdominal pain, often severe and diffuse, severe abdominal cramping, bloating, nausea and vomiting, a change in bowel movements or habits, rectal bleeding, fever, usually not immediately, chills, fatigue. Diagnosis. If client has symptoms shortly after a procedure, doctor may suspect a perforation. If client did not have a recent procedure, doctor will ask about symptoms and medical history. A perforation during a procedure may be seen when it happens. A physical exam may be done to find out abdominal tenderness, dullness, thrill, absence or slow peristalsis, abdominal girth increase and signs of shock. Blood tests may be done to look for any signs of infection. Air and fluids in the abdominal cavity indicate a leak from the intestine. This leak may be seen with X-ray, ultrasound, MRI scan, CT scan. Management. Treatment will depend on the size of the perforation and how long it has been open. Smaller perforations may be able to seal themselves. In this case, client may be monitored for any changes. Additional imaging test will be taken to make sure there is no more air or fluids moving into abdominal cavity. Client will also be given antibiotics to prevent infection in the abdominal cavity. Larger perforations and those that have existed for some time without notice will require more care. Surgical repair. Surgery may be needed to repair some perforations and clean leaked material from the area. The extent of surgery will depend on the size of the perforation and presence of infection. A small perforation may be closed with no other repairs needed. Some larger perforations or those with serious infections can cause damage to some of the surrounding tissue. This may require the removal of parts of the intestine. It may also require a temporary or permanent colostomy. Antibiotics. Infections can be very serious with colon perforations. The material that moves out of the intestines can contain numerous bacteria and other organisms. The material can cause an infection in the nearby tissue or throughout the body, called sepsis. Antibiotic medications may be recommended to treat an infection or prevent an infection from developing. Analgesic. To relieve pain, e.g. acetaminophen, diclofenac sodium, morphine sulfate. Antispasmodic. To relieve abdominal spasm, e.g. dicyclomine, meftal-spas, spasmoproxavan. Complications. Complications of untreated perforation may include bleeding, infection, peritonitis and sepsis. Death.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.